Good morning. It is another Thursday morning, and here we are finishing up this 5-part series on women's health. If you've missed the first 4 parts, you can catch them on our YouTube channel, which has just recently gone live, or you can actually catch them here on Facebook Live. So where they're archived on the Joseph Lamb MD page. So good morning. Self-care, it's kind of our last topic in this section. We've talked about nutrition, we've talked about bioidentical hormones, we've talked about nutritional supplements and botanical supplements for promoting women's health. We've touched upon the theme that women's health is just a portion of like total body health. So all the concerns, that we think about in terms of looking at men's health need to be looked at in terms of women's health, particularly cardiovascular disease, heart disease, cardiovascular disease, stroke, which is kind of, cerebral vascular disease. They remain the #1 killer of women. So, addressing cholesterol, addressing insulin resistance, addressing obesity becomes a really necessary part. This lecture, we're going to be focusing upon self-care. And, when you think about the functional medicine model, what's unique about the functional medicine model is the attempt to understand our health by understanding function, to understand the processes that may be out of balance or that may have been dysregulated, and the failure to get back into balance, which contributes to development of dis-ease and then illness and true disease. So, the functional medicine model, the analogy I like to use is, think about a tree. And if you've got a tree and you've got big branches coming off the trunk, and those branches give rise to smaller branches and to little leaves, you can almost think about the different branches and their downstream leaves being something that fall into the area of care for a specialist. Kind of in our disease model, allopathic care, the neurologist, the brain specialist is going to take one portion of the tree, the gastroenterologist another, the orthopedist, the psychologist, the, rheumatologist, the generalist, blah, 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 blah. Everybody's getting their part of the tree, and it's what they look at. And in some ways, we get so focused on those leaves that we can't see the tree for the leaves. And our treatments, particularly since a lot of them are aimed at being symptomatic, are kind of, almost like painting the leaves green or gluing them back on when they fall off. We're going to keep our portion of the tree looking really healthy. And, you may think this is a little bit of an exaggeration, but it was actually looked at in a study. They presented, written exams for all sorts of physicians and healthcare practitioners in this day and age of, computerization and multiple guess, entail frequently giving a rather long paragraph that consists of a history and a little bit of a hospital course, perhaps, and some findings, on tests and the such like. And then they jump down to asking you perhaps what the disease is. And then they jump down to asking you what further diagnosis you may want to do. And then they jump down to asking you what the treatment may be. Interestingly, they gave some complicated case studies like this to a group of different subspecialists. And one of the biggest determinations on what diagnosis was picked was what subspecialty you were in. So if you're looking at a complex patient who's struggling perhaps with fatigue and some brain fog and some changes in well-being and maybe some gut health problems and not able to exercise and maybe some insulin resistance and maybe some, vasomotor changes. If you were a gastroenterologist, it was menopause. If you were a generalist, maybe it was, depression or anxiety. If you were, a psychiatrist, it was, it's a mood disorder. If you were a rheumatologist, maybe it was focusing upon muscle aches and pains, and maybe it was fibromyalgia. If you were an infectious disease doctor, maybe it was chronic fatigue and immunodeficiency syndrome. And then everyone treated their part of that without ever realizing that it was like kind of the trunk of the tree, where the kind of underlying processes like digestion and absorption or assimilation of the things we have to take in, or metabolic transformation, the work that the liver does, or whether it was circulation, the heart pumping the blood around, whether it was communication, by hormones and by the nervous system, whether it was physical, whether it was energy production, whether all these processes, trunk of the tree, and how they're affected and what can go on with them. And then the piece that really doesn't get looked at often, and this is where personalized lifestyle medicine comes in. This is where functional medicine comes in. This is where naturopathic medicine comes in. This is where holistic medicine comes in, integrative medicine, whatever you want to call it. It starts looking at the roots of the tree, what we call the modifiable lifestyle factors, the things that we can make a difference in. So, down there are things like diet, nutritional supplementation, but sleep is down here, exercise is down here, habits are down here, and finally, kind of the way we think. So we're going to touch upon some of these today. Let's start with sleep. If you go back probably to the 1950s and 1960s, people looking into sleep wanted to get an idea about how much sleep does a healthy person require. Kind of what would someone do if they didn't have the cues of the outside world. So studies were done. They actually did them in France, and they took advantage of these old salt cave mines, that went down thousands and thousands of feet, and it was pitch black down the bottom of the mine, and they made apartments down there, and it was quiet, and they put people down there for extended periods of time for weeks without any cues as to what time of day it was, or if the day was passing. The kitchen was stocked with food. They had the work that they were doing, which was academic type work. I think they actually had them, having to do like math problems and do a certain number of them, as their work. And, they had an overwhelming amount of them to do. So there was no judgment about this is today's and that's tomorrow's. There was just more work. And, they had some entertainment for them, but none of it wasn't like television, which would be a cue as to what time of day or the show just showed up now. It was things that, they could have a store on hand. There was no noise from anybody checking on them. There was no telephone calls. There were no connections with family. And, they were really removed from any time cue. And they were removed from sunlight, which could be a time cue. And what they basically found was people actually had a slightly longer day. Their rhythm was slightly longer than 24 hours. And it's actually been shown that if you have a slightly longer day and time cues and train you to a shorter day, that's healthier than the person who has a short day who gets them trained to a longer day. So you want a slightly longer circadian rhythm, and you want good cues to pull you back in. And this is where melatonin comes in and plays a role, and we'll talk about that in a moment. But, the point being that in this setting, their day lasted a little bit longer than 24 hours, about 10 minutes or so. And the other thing that was found was that most people ended up having a siesta. So people, if we call the wake up the start of the day, people would wake up, they'd have about an 8-hour period of activity and eating and exercise and the such, and then they would take about a 1 to 2 hour nap, 1.5 hours, somewhere in there. And then they would get back up and they'd have another period of being awake. And this period was shorter. It was like 5.5 hours. And then they would go back to sleep for nearly 8 hours, 7 to 8 hours. So this would add up to 24 hours and 10 minutes. And the key was that, people were taking a siesta. So, cultures in which they have a siesta to get out of the heat of the day and the such like, probably that fits. And, when you look at the circadian rhythms that we have for our cortisol levels, and, you get the morning spike even before you wake up, you get going, you're ready to face the day, and then it comes down through the morning, and it's almost down to baseline by 12 noon. And then there's a slow, gradual decline until bedtime, and then it drifts down a little bit more, and then it spikes up as we get ready in the morning. This sort of rhythm fit with being able to take that nap in the afternoon and being able to rest and getting back up and kind of seeing how we act and the such like. So, as we look at these patterns, we say to ourselves, how much sleep do we need? We have this goal of saying, hey, sleep 8 hours, right? But, that sleeping 8 hours piece, that's kind of an arbitrary number. And very few urban North Americans get that. More people get like 5 and 6 hours, and it's disturbed sleep. So noise has a lot to do with that. Light has a lot to do with that. I live in the Pacific Northwest, and frankly, I don't have great curtains on my bedroom windows. And the days are getting long. It's still light at 9 o'clock at night, and it's light at 4:45 in the morning. So, we got to think about that. I'm getting to the point where night will be shorter than 8 hours. And if I'm reserving going to sleep when it's dark, then I'm going to have a harder time resting. So dark bedrooms, going to bed at the same time is good. Trying to cut down on noise. If you're living somewhere urban and you simply can't cut down on noise, a white noise generator or maybe hearing plugs or something of that sort would be helpful. Having the same routines, about going to bed and going to bed at the same time each night, not using the bedroom for other things like, it shouldn't be the place where you do a lot of reading. It shouldn't be the place where you watch television. And indeed, if you do wake up, you shouldn't lay in bed for a long period of time, not sleeping. If you frankly are full-blown wide awake and you can't easily go back to sleep within a couple minutes, you should get up and go do something relaxing. Blue light has been an issue in terms of screen time right before we go to bed, since more and more people, instead of reading books or reading magazines online or the such like, or reading an article online, and it's the flashing lights, it's watching TV, it's leaving the TV on after we fall asleep, noise from increased commercials. We want to do all of that. It's also electromagnetic radiation. Stephen Sinatra and the book has gone away, so I don't remember his co-author's name at the moment, but he wrote a book called Earthing, about getting rid of the charge, the electrical charge we build up. And, they actually make like a mattress pad, which is like a grounding pad, and you plug it into the wall and it plugs into just the ground on the plug. So it takes away the electrical energy. We've got all of this electrical energy around us all the time. We may be charging our phone at the head of the bed. We may have our clock at the head of the bed. We've got all this alternating current. A lot of our bedrooms are set up to have a plug on both sides of the bed. And, what frequently happens there is that there's a drop down to those plugs, which comes right down right behind the bed, and it goes off to the bed. Well, because alternating current is alternating, the current goes and comes and goes and comes. Because it does that, it generates an electrical field, even if there's nothing on that's attached to the plug. All of these sources of radiation are potentially affecting us. So everything we do to clean up that environment, from a perspective of when we travel and our sleep times get thrown off, 1 to 3 milligrams of melatonin's great, magnesium's great at bedtime, 5-HTP's great at bedtime, all things that we can do to help us with sleep. And, depending which one we choose is partly dependent upon all the other things going on with us. Exercise, movement, it's kind of interesting because, there's a slow progression. Like, if we've been active in high school or active in college, we maintain strength for a while, right? But the first thing that we lose endurance. Then we lose flexibility. And, we don't even really realize that we're losing that flexibility until we're called upon to do something. Like the first time you lift weights, it may not have been that hard. It's been years since you've lifted weights and you did some curls, and it really wasn't that hard work to do the curl with the barbell. And then that evening you're going, oh my God, my biceps hurt. And it's because the stretch, once you lost flexibility, so losing endurance, losing flexibility, eventually losing strength, and then later on losing our balance, just because, we haven't been working on our proprioception, we haven't been working on our strength, that kind of progression of aging, we've got to stop that. The basic recommendation is, one basic recommendation is getting, in the neighborhood of 150 minutes of exercise a week, working out to, 7 days of 20, plus, or like 6 days of 25 minutes or so. That is a great start. That would be excellent for most people. One of the things we need to remember, as in all these things, we don't have to meet just some threshold. And then if we haven't met that, it's not good. So like, if you can't get a 25-minute exercise in today, it doesn't mean that I shouldn't exercise. You exercise for 10 and you try to pick up on it on another day. Anything that you do is going to be better than doing nothing at all. And, that's why, simply, using the pedometer function on your phone, measuring your steps and figuring out where you are. And if you're getting 5,000, making it 10,000. If you're getting 10,000, increasing the intensity of how you get those steps. So, instead of, walking and doing your daily chores, you maybe say, okay, I'm going to get some of those steps by doing a fast walk, a continual walk for 15, 20 minutes, doing some resistance training. One of the things that we've learned is that sort of high intensity for brief periods of time is better than low intensity for longer periods of time. Hence the kind of way, the movement towards gyms like Orange Theory and various aerobics classes and HIIT workouts, which stands for high intensity interval training. You go hard for a minute, you rest, you go hard. You can even do that when you walk. Walk as fast as you can for 30 seconds and then walk at a comfortable pace for a minute and a half, and then 30 seconds of walking as fast as you can. That's a form of HIIT. And, working your way up. if you're not capable of doing much exercise at the moment, start out with 2 minutes a day if that's what you're capable of, and do it like twice a day. Even if it's just doing a couple laps amongst the rooms in your house, or if it's walking down to the mailbox and back, or if it's getting on the exercise bike that has been, really a hanger for clothes for a while. Do a couple minutes. Do a couple minutes later in the day, do that every day for a week. And when you're doing that comfortably, then kick it up a notch, go to the next step, kind of a graded exercise program. There's an author, a gentleman who I know, David Goggins, and he wrote a book called Can't Hurt Me, and it's gotten a lot of attention lately. And I have to frankly say I'm not enamored of his YouTube videos because he drops the F-bomb way too often in those videos. But he's a much gentler man in person, and I think a courageous man in terms of what he's done in terms of his special forces work and the amount of effort he's put into really fundraising for families of wounded and injured and killed veterans and the such like. But, there's some lessons that can be learned from that book. And one of them is do something every day that sucks. And, that sounds like really bad advice, right? You hear do something every day that sucks. Why would I want to do anything that I didn't enjoy? Why would I want to do anything that I didn't like? Well, what he really means by this is pushing yourself a little bit. Like when I first started rowing and working out with my trainer, which now goes back to like December of 2018, when I made a real effort to start exercising more, we identified that I like rowing on a rowing machine as exercise. And we identified that, and I was able to row kind of as a workout warm up. And oh my God, 500 meters seemed like it was a lot. I was tired. It was hard. And I could have come to the point, particularly on the days that I wasn't working with her, I could have come to the point like, okay, I did my 500 meters. But I had read David's book, and I said to myself, well, it would suck to go another 50. I don't really want to go another 50. It doesn't feel great to go another 50, but I went another 50, or I went another 100, and did a little bit more each day. And then suddenly doing 500 wasn't tough, doing 750 wasn't tough, and doing 1,000 became okay. And eventually I would get to the point where I did some races, both on the ergs, on the rowing machines, and I've done some races in my kayak now. And I'm okay for my age group. I'm not the fastest, I'm not the slowest, but I got enjoyment out of it. And it was because I pushed myself each day to do a little bit more. One of the things that I found really helpful kind of came to this recognition of how to motivate myself to exercise was the whole concept of having a stretch goal. And having a goal be not about how many times I was going to go to the gym, because I was frankly struggling with that, right? It was like, I see my trainer twice a week and I'm going to exercise one more time a week. And, oh, well, this is tough. I've only been 3 times this week. And, if I really want to get a change in how I'm doing, I should go 4 times this week. And yet, you say to yourself in terms of that 4th time, well, it's Thursday, I'll go Friday. Well, it's Friday, I'll go Saturday. And then you don't get it done, but you say, okay, well, I did 3. How bad is it to do 3 and not do 4? So what I ended up doing was picking the exercise that I liked best in setting myself some performance goals around it. So I said to myself, okay, I'm going to row 50,000 meters in a month. And I'm going to have a stretch goal. So if I get to 75,000 meters, I get to give myself something. Oh, and by the way, because I reached it, I'm going to make my base goal 5,000 meters more. Well, I've been up and I've been down and I've been up along the way, and I've given myself some toys, and I've been as high as like 90,000 meters and as low as 40,000 meters in a month, depending what else I've been doing or depending how I've been feeling and the such like. But having that goal really worked for me, because what it did was, okay, well, I'm only here 3 times this week. I really need this workout to be more focused, to be longer, to be a little bit harder, because I need to get those extra 2,000 meters in if I'm going to meet my goal of 65,000 meters this month. And it was a way for me, not to have to schedule a specific time, but to recognize how much work I wanted to do to be in good shape. So having a goal and a stretch goal and playing with that. And, if there was a month in which I missed my base goal, I gave myself some grace and reduced it by 5,000. And so that's why the numbers have played around. The most important thing is, when you are working out and you're trying to work hard, give yourself some grace so that you have the energy to remotivate and keep going. So we've talked about sleep, we've talked about exercise. The other piece is, just kind of thinking about, how do we reduce stress, right? What portions of our life can we make a difference in? Like relationships issues, the such like, how do we come to an awareness of what we want? Well, a lot has been written about stress, and, and frankly, we're doing like what's called 90 minutes of authoring, and uncovering certainty and rediscovering soul, the Consilience Partnerships. So I do this on Saturday morning, 9 a.m. Pacific Daylight Time. So that's Michael Stone, Susan Buell, Courtney Suter, and myself. Monique Class is part of that, but she won't be on Saturday's presentation. And it's this kind of recognition of how do we change the way we think so we get on this journey and we keep this journey moving forward. And there's lots of components to it. But, basically for me, it's coming to the realization that I don't want to be distracted, that I want my antidote to the stresses of life, to the distraction of life, to be mindful, to be kind of centered, to know who I am. And in knowing who I am, recognizing that there's kind of this spark of creation, this gift that I've been given, this opportunity to be here, and asking, how do I reconcile that special place of me with, kind of the stresses of living a life with the demands of the outside world, and, and kind of the balance of ego against spirit and coming up with a soulful presence. And when really established there, recognizing that if all of my fellow men and women have that spark of spirit as well, they're worthy of my respect and reverence, and they're worthy of me treating them that way in relationship and thinking about what it means to be of service. So stress reduction, we talk in our healthy transformation classes, and we'll be talking at Harmony Hill during our 3-day functional medicine journey, and we'll be talking at Feathered Pipe during a journey to wellness for 5 days. We'll talk about the technique of stop, breathe, reflect, and choose. But it all comes down to living intentionally, living with awareness, living, not just recognizing what's going on within us, but recognizing what's going on out there. And then, other portions of our life come down to, are we doing all of our health prevention? Are we getting the appropriate vaccines? I wouldn't put myself in the pro-vaccine camp, and I wouldn't put myself in the anti-vaxxer camp. I think there's decisions that need to be made for every person about the timing and the utility of that vaccine for them. Frankly, for COVID vaccination, I think particularly given long haul syndrome and such, I fall very much in the pro-vaxxer camp for COVID. We finally have gotten approval to start giving COVID vaccinations here in the office, and we're getting the last few pieces of that put together. But I think that's an important part, thinking about things like mammograms. And frankly, I think mammograms are highly superior to thermograms, for example. Getting colonoscopies or doing Cologuards if the clinical setting's right and the information's going to be good enough that you get from the Cologuard. Getting, not during a women's health discussion, but for men, getting their digital rectal exams, checking a PSA. All of these things become really, really important. Having self-care, having, the respect to want to take care of ourselves. I think, many women face this challenge every day when, and some men do when they cook dinner, but you cook dinner, you have children, and you're faced with a question, aren't you? Do I give them something that they would like to eat and that they'll eat without an argument and, I don't need to teach them a lesson about, they'll just eat it. Like, do I give them chicken nuggets or do I give them ice cream for dessert? Or do I take the harder way of saying they need to learn to eat well because I want them to be healthy when they're 50 and 60 years old. Same thing in our relationships, right? Being intentional in our relationships. It may be a lot of fun to go out with our wife or partner on Saturday night and, eat the chips and salsa, have the margaritas, have the beans and rice that come along with our food and do that. And maybe we're not as fit as we should be. And maybe our wives aren't as fit as we should be, or maybe we're even less fit. Maybe, our weight and body composition's contributing to, insulin resistance and inflammation that's taking place and compromising our lives and compromising that journey towards optimal wellness and saying the journey's going to have some sand traps. It's going to have some quicksand to fall into. What does it mean to sit there and say to a partner, hey, I enjoy your company. I want to be around for you and I want you to be around for me. What does that conversation look like? That's part of self-care. So, all of these pieces, good emotional health, from, kind of a worry about dementia down the road point of view, doing something that stimulates us academically, not just watching a screen, not being distracted. Aldous Huxley, for example, wrote Brave New World. And, it gets lumped into the dystopian novels, but it's not a totalitarian world. It's not the world of 1984. It's not the world of Animal Farm. It's a world of people getting distracted from what's meaningful. Kind of the bread and circuses distraction of their entertainments. And we are all falling into that trap with our devices, right? We can spend hours on YouTube. We can spend hours on cable TV. We can spend hours listening to podcasts. You can spend hours listening to me. You have to decide whether this stuff is moving you towards your goal or not. Some is great. Spending an hour watching your favorite television show once or twice a week, wonderful. Particularly if when it's all done, you discuss it with your partner and you talk about what you thought or what you liked. And, you maybe pause partway through it and you go, who do you think the bad guy's going to be? What do you think's going to happen? All of those things, that's intellect, that's using your brain. You're not just being washed over, right? Even if it's something like, and one of my guilty pleasures is like when I'm in a hotel room, binge watching beating Bobby Flay. I write down some of the menu ideas as it goes. I start writing down about what I would do differently. I try to figure out what it was that he put together that made something unique. Again, it's not just washing over me. I'm engaging, and it's giving me some intellectual stimulus. And then I try to do it a little later. Everything in our life should be about engaging as a fully vital person who talks about what their needs are, who's in honest communication, so the authentic you shows up. That's what self-care is about. The nutrition part, the sleep part, the exercise part. Oh, it was habits that I wanted to talk about for just a moment and almost forgot to talk about. Habits. We should not smoke. We need to be really careful about substances. A little bit of alcohol has for a long time been considered okay. But, there was a recent large meta-analysis that came out in the last year, which raised the question of, is it really okay to drink a little bit of alcohol? The studies that were based in the past looked at non-drinkers 1 to more drinks a day, and the curve went flat and went up, and it was really when it got above 2 drinks a day that the risk went up, right? Well, they did this meta-analysis, and they asked the question about, why do people not drink? And realized that it fell into 2 reasons. 1, people didn't drink just simply because they didn't like to drink, or that there was some family history perhaps that kept them from drinking, either psychological scars or kind of seemed to be a genetic predisposition to alcoholism. People who don't drink because of choice were here. People who don't drink because they've been diagnosed with something, like, okay, they are an alcoholic, or they have heart disease and it may have contributed to the heart failure, or they have neurologic disease and it's contributed to peripheral neuropathy. That group was here, then 1 drink, 2 drink, 3 drinks a day. So instead of a curve where the non-drinkers for just because this is what they intended, and the non-drinkers because of alcohol, that group used to be here and didn't seem to be much different than 1. But the group that doesn't drink at all is down here, and the reason with medicals here. So the curve actually goes like this. So there is some evidence that probably staying away from alcohol entirely is a good thing. But, if you limit yourself to like 15 grams of ethanol, which is in, 12 ounces of beer or 4 to 5 ounces of wine, depending on its strength, or in 1 to 1.5 ounces of alcohol, it's 1 ounce if it's 80 proof. But if you get above 80 proof, it starts going up, so there's a reduction in how much alcohol, there's more alcohol per ounce. And so you're aiming for about 14 to 15 grams of ethanol in a drink. So when you look at this, you want to stick to generally 1 drink a day as a woman, smaller body composition, smaller size, smaller liver. Men, maximum 2 drinks a day. It's kind of interesting. In my years in private practice, I've probably seen a handful of women who ended up with cirrhosis as a consequence of matching their husband drink for drink. The 125-pound fit woman who has 2 significant martinis in the evening, while her husband's 250 pounds and 6'4", and not in great physical shape, but has a bigger liver. And he didn't end up with cirrhosis, but eventually she would, drinking those 2 large martinis each day. So, going above that 1 ounce, 1.5, 2 ounces a day. At the end of the day, we have a situation in which self-care is important. Caffeine, we'll talk just briefly. Some of us are very sensitive to caffeine. Some of us are not. Genetic component to this. If you're not sensitive, then caffeine is probably a great boon. If you are sensitive, then it needs to be limited. Caffeine can have a negative impact. It can drive you to expend energy that you don't have the reserve for. That's why it's bad in people who have some issues with the hypothalamic, pituitary, adrenal, and thyroid axis. So again, it's not easy to say, but you can pick it back and forth. Soft drinks, while I'm not a fan of highly sugared soft drinks, I think they're much better than diet drinks. I'll admit they're my guilty pleasure. But, I don't like hot beverages, so I end up getting my caffeine from Coca-Cola. But, not a great thing, but it speaks to the final piece that I would say is, when we make all these lifestyle changes, sometimes we get to do things that aren't necessarily great for us. They shouldn't be the worst possible behavior, but maybe they're not the best possible behavior. And when we choose them, they're kind of a functional cheat. We know from a perspective of being self-aware where we are. We know from a perspective of being self-aware what the cost is. We do it mindfully. And then, we make our next decision having that piece of information in mind. It's eating well 5 nights a week, and it is then going out and celebrating our date night with our partner, and seeing that we have fun. And if it's having a margarita, if it's having the beans and rice, that's okay. So self-care, as sleep, exercise, diet, nutrition, nutritional supplements, the appropriate medications, the right habits, and how we view the world from an emotional, cognitive, and spiritual perspective. All of these things dictate what our journey is going to look like from where we are now, possibly through illness and disease or preclinical illness, right on up to hopefully optimal wellness. I hope you enjoyed this series. I've enjoyed putting it on for you, and we have ongoing series at the moment on gut health and on cardiovascular health on Monday mornings for the next few weeks. We've got our third Thursday of the month, Lunch and Learns, which are continuing, and looking at a calendar, that'll be next week, will be our next Lunch and Learn. We've got our Monday afternoon coffee breaks with Dr. Michael Stone and myself, and the Consilience Partnership is going to be talking about the work that we're doing at Harmony Hill and Feathered Pipe Ranch on Saturday morning, 9 a.m. Pacific Daylight Time on Facebook Live right here, Joseph Lamb, MD. There's going to be a really special announcement on Saturday morning, so be there and have a great day.